What is the treatment for fibromyalgia?
Well, the treatment's kind of evolved over time. In recent years, functional MRIs have shown that the nerve pathways of fibromyalgia patients light up quite differently.
So the functional MRI can light up nerve pathways?
Yes, and it's done in studies. We don't do this out in the real world, but in the studies, they do light up differently. And what that's telling us is that the neurohormones in these patients are different. Their nerve pathways seem to be oversensitive, so that makes them more sensitive to pain and to sensations that normally you wouldn't sense as pain.
So it's like somebody that would have sounds hurt their ears, like hyperacoustics, not with
Exactly.
not with this.
They're hypersensitive. It's like their nerves are sending off too many signals, and they're just too much stimuli.
So there's something we can work at toward treatment of that. So what do we do from there? If it fires off too much, what do we do?
Well, altering the neurohormones around those nerves seem to be the most effective. So there's newer medications like Cymbalta and Savella, which are antidepressants, but they also help significantly with pain. And sometimes we use them just for pain control in patients who aren't depressed.
So in people that will use Cymbalta or Savella, there was one other you mentioned, do they look it up on the internet and say, oh, you're giving me an antidepressant, I'm not depressed?
I actually tell them ahead of time that it's an antidepressant and that we're using it for pain. And I explain to them it increases their norepi and their serotonin levels. And particularly with those two drugs, it does tend to lower pain. I'll have patients come in and say, my pain's 50% better.
That must be like a gift. They must say, oh, I never believed I could feel so if they're 50% better. What do they tell you if you put them on a medicine and they say, I'm 50% better? Well, describe what they will mean by that.
They have less pain during the day. They're more functional. Usually they have less fatigue. But again, we usually attack it from multiple directions. So we're trying to improve their sleep. If they need a sleep study, I send them for that. If they don't.
Does that help them sometimes?
It does help their rest, yes. The patients who will use the CPAP, that's a big issue with the sleep studies, and people have sleep apnea. Only about 50% of my patients actually use the mask. But the ones who do, I do think it helps with their fatigue. If they sleep better, they feel better.
So and that's a big problem we mentioned, is they don't sleep well.
They don't sleep well.
So you get a sleep study.
Yes, and the medications I tend to use to try to help normalize their sleep would be some of the older drugs, actually, the tricyclics, amitriptyline or Flexeril. It tends to help get them to sleep through the night so they wake up feeling more rested.
Without a sleeping pill, it's a medicine that decreases the firing of the neurons.
I'm not so sure the tricyclics do that as much, but amitriptyline does tend to decrease pain, and it works the neuropathic pain as well, so it may work along those same lines in those patients. But both of them help normalize the sleep.
Do they since they're antidepressants, they make people feel better, or it just is helping toward the aches?
Well, Flexeril is a muscle relaxer. Amitriptyline, I use in very low doses, so typically the antidepressant effects are not seen in the patients, although some patients do feel better mood-wise just on that.